Cancer has become one of the most prolific diseases of our modern era. There has been thousands of new breakthroughs that have allowed us to better understand and treat the disease. In order to truly appreciate modern-day ideas, it is important to understand where these ideas originated. The 19th century is the period of time where cancer research begins to take off. Better microscopes allowed scientists to understand the human body more closely. As a result of the cell theory discovered by Schwann and Schleiden, new theories came to light suggesting the different causes of cancer. Johannes Müller, a pathologist in the 19th century, introduced the blastema theory, in which he stated that cells did not come from normal tissue but rather masses of cells that dispersed between normal tissues. Rudolf Virchow, who was a pathologist in the 19th century, suggested that cancer was a neoplasia, which was an uncontrolled growth of cells. James Paget, an English surgeon and pathologist, proposed that cancers were hereditary and those who got cancer already had a predisposition to contract the disease. Julius Konheim, a German pathologist, argued that tumors came from residual cells that were misplaced during embryonal developments. Johannes Fibiger, a professor of pathology at the University of Copenhagen, introduced the parasitic theory, which indicated that cancer came from a nematode worm. Theodor Boveri, a German professor, proposed the somatic mutation theory, which argued that abnormalities of the chromosomes were the reason cancer developed. Women were the cornerstone of cancer and public health attention for much of the early 19th century. The idea of cancer only remained around women's reproductive systems because it was believed that women were especially liable to breast and uterine cancer. However, after continuous studies, it revealed that cancer in men was in fact rising at a much faster rate in men than in women. Moreover, it would be found that the cause of cancer had more to do with the predispositions that were already inside one's body for both men and women. Additionally, in the 19th century, physicians became convinced that Galen's humoral theory and the idea of iatrochemistry were both insufficient explanations of understanding cancer. Physicians stopped looking at cancer as a systematic problem, but rather as a localized entity that would spread throughout. They were also able to differentiate the meanings of a malignant and benign tumor that still uphold to this day. Karl Thiersch, a surgeon from Germany in the 19th century, illustrated that cancers metastasize through the spread of malignant cells. When cancers metastasize, they spread from original location of the tumor to a different part of the body. Physicians conclude that cancer is an age-related disease. For instance, it was found that 1 in 400 women that were 30 years old had a risk for cancer, while 1 in 9 women that were 70 years old had a risk for breast cancer. Those who suffered from poverty also had a higher risk of getting cancer. Because cancer only became a disease of the 19th century, there had been no previous specific treatments to cure the disease. Oncology became an emerging field in the late 1800s, which allowed for more advanced studies in understanding cancer and better treatment. In 1884, the New York Cancer Hospital opened, which became the first American hospital that specifically treated cancer and any of its related diseases. The first effective treatment known to cure cancer was surgery. Because many of the surgeries done in the early 19th century were still inhumane and unsanitary, Theodor Billroth, a professor and surgeon at Vienna, did many surgeries to find the safest and most clear route to the tumor. The main type of surgery that people used was en bloc resection. An en bloc resection required the removal of both the cancerous tumor and healthy tissue that surrounded it. In the 1840s, anesthesiology became a vital field because it allowed surgeons to do more extensive surgeries. Additionally, the understanding of asepsis and antisepsis in the 19th century encouraged surgeries because it resulted in less surgical deaths. It allowed surgeons to work more carefully and diligently because they didn't have to worry about open wounds turning gangrenous. Towards the end of the 1800s, the Halsted mastectomy became one of the most popular treatments for those with breast cancer. The surgery consisted of the removal of the breast, muscles, and auxiliary lymph nodes, and because Halsted noticed relapses from just the removal of the original tumor, he dove deeper into the body and removed the tissue and the muscles surrounding the tumor. In 1892, a new form of treatment called anastomosis was invented to treat those with colon and rectum cancer. Because some people had a hereditary predisposition of getting cancer and there was no cure, the best thing to do was to take preventative measures in hopes that it would minimize the chances of getting it. Lifestyle habit changes like eating good food, minimizing the amount of bad air intake, Getting sufficient amount of rest and exercising were some of the preventative measures taken. Without 19th century discoveries like the cell theory or Halsted's radical mastectomy, it's difficult to say where modern cancer science would be. It has set the entire basis for understanding the causes of cancer or finding effective treatments for the disease. As cancer research will only continue to get more complex, it is important to remember that all of this would not be possible without the discoveries of our predecessors.